Welcome to the Generous Benefits Podcast, where we help employers build people-first benefits that make business sense. I'm your host, Amanda Brummitt. Today, we're joined by Stephanie Porrino, Director of Human Resources at Hendry Marine Industries. We'll dig into practical cost containment strategies, from reference-based pricing to primary care models and pharmacy benefits, and talk about how benefits shape your employer brand. Stephanie, thank you so much for being here today. I know that your name is well known in the industry, but I would love it if you could just start at the beginning, assuming nobody knows you, with who you are personally and professionally. And then I want to know how in the world an HR leader got so deep in benefits.
Okay. Well, thank you so much for inviting me to be on the podcast. It really is a pleasure meeting you and being a part of this healthcare industry and community, which I never thought I would be part of. However, so I'm Stephanie Porrino. I am the Director of Human Resources for Hendry Marine Industries, and that's a shipyard at the Port of Tampa in the Tampa, Florida area. And I have been in HR about 30 years.
Wow.
Yes, showing the age, but that's okay. So in HR, I've done pretty much everything. So I've always functioned as a generalist, but over the past 10 years, I became more of a benefits and healthcare strategy specialist. Mm-hmm. And I went into that kicking and screaming, but we can get into that. And I recently got remarried in September.
Congrats.
Thank you. Hence the new name Porrino that everybody's still getting used to. And I have an 18-year-old son named Jacob, and we live in the Tampa area.
Oh, love that. Okay, so how did you decide that, in addition to knowing all things human resources, that you were going to take that deep dive into benefits?
So interestingly enough, about 10 years ago, I was working for a different organization. And I tended to find myself working for companies that were family owned, even if it was a few hundred employees. I always gravitated to privately owned, family owned businesses where I knew as an HR leader, I can make an impact. Not that I couldn't on the bigger company level, but I always felt like there was too much red tape or things going on there where I'm in a smaller organization. And as long as they understood the work I wanted to accomplish, it was a great match. And I was fortunate to find that in a few different places. But at my last company, we were self-funded with one of the big carriers, one of the BUCAs. Mm-hmm. And despite doing all the things that were suggested and using our wellness funds and all the buzzwords that the big carriers use, we still had an 18% increase. Now, what I should say is that from a demographic standpoint, didn't really add up. Just based on, yes, we had a lot of members covered, like about 600 covered lives, but we only got so much data. So we felt like there wasn't really anything to validate that increase. So therefore, some of the people on my leadership team, unbeknownst to me, went to a benefit symposium and learned about reference-based pricing. So the funny part of the story is when they brought it back to me and said, hey, we think we want to explore this because we can't sustain the 18% increase and it's just going to compound. I understood that. So my first response was, you've got to be kidding me. It's never going to work and you guys are crazy. Well, because, in HR, we are trained, you offer benefits and you want them to be competitive, but it's very surface level. So when that was presented to me, I thought, okay, well, I'm the vice president of HR. I do have fiscal responsibility to the bottom line. So I need to be open-minded and listen to what this is. And that is where the passion started. When I finally understood where the disconnect was, why I always questioned renewals or why I was always curious, like how they got the numbers, that started opening up Pandora's box. And once I figured out as an HR leader, I could essentially have the same type of plan, design and functionality, and save the company a bunch of money, but still offer extremely generous benefits to the employees. That's where I started finding that passion even more.
Yeah, incredible. And I want to back up just a minute. So, Stephanie, I'm a club of one person that is trying to dismantle acronyms in health insurance. So, for anybody that doesn't know, a BUCA is Blue, United, Cigna, Aetna. And Stephanie she spelled out reference-based pricing. Thank you for that Stephanie, listeners, if you hear RBP, that is the acronym for reference-based pricing, but Stephanie's awesome and actually told you what it was.
Well, that time, it may happen again. But yeah, so I started learning and I'm like, wow, like that, I can do that and we can do this. And it was just very enlightening. And then, you almost become like a mad scientist because you're able to essentially deconstruct your healthcare plan that you have in a traditional sense.
Yeah.
And then reconstruct it with those components that are making up the other plan that are not visible to you. You're like, oh, okay, I can pick my network, my PBM, my stop loss, and everything else. And the TPA, do that yourself. And you're able to have more control and have more visibility. So it was a no-brainer.
Yes, for sure. And PBM is pharmacy benefit manager and TPA is third party administrator. Yeah, it's good. I want people to know both words.
They should. Yeah. Very important.
So let's start with cost containment. And I think reference-based pricing is a great place to jump into that. What is reference-based pricing? How should employers be using it? And where can they find resources?
So RBP, or reference-based pricing, is essentially using Medicare as the basis for reimbursing charges that are incurred at a facility or even at a doctor's office. So if you were to use a Medicare pricing as the platform to reprice a regular claim, it's going to be a Medicare plus. It's not going to start from the top down, where in the traditional model, you're getting a discount off of some number that you don't know what it is to begin with. So it's really interesting because when I started hearing that, I'm like, so I go to one hospital and a CT scan is one amount. I can go to a different hospital 5 miles down the road and they're going to charge something different because there's nobody regulating the pricing that the hospitals are charging our general public. And without pricing transparency or knowing, essentially employers are paying for services and they have no visibility to what those actual costs are. So reference-based pricing, that model protects the pricing and allows your claim spend to go down excessively.
And then is Medicare, is it the absolute benchmark, or are there others that you can utilize?
Well, typically it is Medicare as the basis, but as things evolve and change, there are other things and algorithms that can be used, but it's primarily Medicare.
Okay, well, that really helps on understanding reference-based pricing as a strategy. Another one that I hear a lot is either on-site or near-site primary care. Do you find that it really does save time and money for employers? And what are your thoughts on it?
I'm a huge fan of it.
Okay.
And there are so many reasons why, but when we think about affordability to care, a lot of employers are in these like high deductible healthcare plans where the deductible might be so high that it's almost like they're functionally uninsured.
Yeah.
So people may not go for the care they need because they can't afford it or can't take the time off. Also to mention, the limitation of primary care doctors being available and the fee-for-service model that is, really pushing people through the system rather than having that connected time and have that continuity of care with the same person.
For sure.
Those are really big things that companies need to think about. So in our case here at Hendry Marine, when I moved over here in December of 19, this is an interesting part of the story. I came in as a fractional HR director. Originally, I was a consultant. And when they were interviewing me for the consulting position, I was interviewing them because I think it's really important to have that mutual connection.
Ooh, we could do a whole show on that.
Yeah. I mean, you want to, if you're spending your time somewhere, you want to make sure you can add value and they see that value you're going to add. So that was my perspective on it. And sure enough, they were doing reference-based pricing and all the things that I had just done at my prior company. So long story short, back in 2021, we were doing a mid-year review. And again, being self-funded, there's a whole new perspective because you have so much data and analytics to work with. And it really helps you create a healthcare strategy and roadmap. because without that, I call it writing blank checks. So what I noticed, because I'm really big into the data, and I noticed that only 15% utilization was for preventative wellness exams.
Ooh.
Now, a little bit about Hendry Marine. We have about 300 employees at the Port of Tampa here, a shipyard. 95% of the employees are men, late 40s, early 50s. When you think about that and a very low utilization of preventative wellness, that was starting to tell a story.
Yep.
And that story would have been major catastrophic claims because people are not getting the basic care they need.
Exactly.
So I was at a conference the next month and happened to see an on-site primary care clinic that was mobile. And I went in and I looked at it and I said, that's what we need. Because I knew it's kind of like the employer has to know the habits of their employees. And ours was illustrating they were not going to go to the doctor. We considered near site clinics, but again, they're not going to go to a near site. That's just for our company. So we brought an on-site primary care clinic to the shipyard and we started 1 day a week. And what was interesting was I thought I did a lot of homework to get ready for them to come on site. And I was trying to think about what are the questions my employees would want to know about the clinic to make them want to go. So you do the FAQs to prepare. And the one thing I didn't think about was them wondering why we want to know about their health and medical information. Never dawned on me. And when the clinic opened, we really initially were not getting people in. So thinking on my feet, I was like, all right, we need to do something. We need to drive engagement so that they at least try. So literally making this up as I'm going along. And I'm like, I'm going to ask for forgiveness later. But I ended up, we put a contest together and we said, all right, anyone from January to April who goes to the walk-on clinic, I'm sorry, that's our on-site clinic partner, for their preventative wellness benefit is going to be put in a drawing for 5 days of PTO.
Ooh, sign me up.
Well, that was the idea. So thank goodness employees started using the clinic, and really it was to win PTO. But actually, overall, we all won because we had one employee that went in to win PTO and the doctor asked him, he said, you had a lump in your neck? He had stage 4 cancer, had no idea. Had that clinic not been there, I don't think he'd still be with us, but that he's happy and thriving and he's doing well. Same thing, another employee goes in to try to win the PTO and his blood sugar is so high he almost had a stroke. So they got him on, continuous care weekly with the physician that, was seeing him. And they became, the cheerleaders that I needed.
Yeah.
And it started growing organically. And I mean, that was how we gave back to our employees and their families, because they don't have to clock out. They don't have to use PTO. It doesn't cost anything. And I did a big mind shift in the last 3 to 5 years, because I used to think, well, employees should contribute. But now it's more, what can we do as the employer to make it accessible to have better outcomes and not make it too difficult?
Yeah, definitely. How did you overcome that trust factor of knowing that my employer knows what's going on with my health?
That's why we did the contest, we just needed to give them the reassurance that they are a separate company. We're not associated, we're just in it because we're interested in their well-being.
Yeah. So you actually said that.
We did. We explained that after the fact, but then we did the contest and got people in there. And that's when the interest really started. And we just started our 5th year with our on-site primary care clinic. And, we have a third of our employees using the clinic. We have family members that come in regularly because they're invited as well.
Nice.
So, yeah.
Incredible. And then the beauty of the on-site clinic is you've removed a massive barrier. They don't have to go anywhere to get it. Could you get the same benefit with a primary care doctor across town or virtual care?
So I'm fairly certain that a lot of physicians will do direct primary care Hospitals also are wanting to work with employers to do
Sure.
direct primary care as well. I think it depends on, the employer taking that step and having that conversation, making sure they have to be working with the right insurance advisor. That's the
Of course.
first
Yep.
thing first, getting that guidance from them and making sure that you guys are aligned. And then I think together they can go in and have that conversation to build that momentum.
Yeah, for sure. And I'm sure the population matters and makes a difference.
It does.
Yeah. With your population being on site is, I would think, crucial. Absolutely crucial.
There's companies that have, these mobile clinics that they're sharing. It's a shared resource among various companies and like a business park or things like that,
Yeah.
And for us, we ended up extending to 2 days a week because of the volume, and we wanted to make sure there was availability. And, it was access. And while the program started a few years ago, just really focused on preventative care, we have expanded the services and we've created such a healthcare ecosystem internally, and it's gotten a lot of popularity.
Yeah. Most definitely.
Yeah. I love it. It's been like one of my favorite projects because I know we're taking care of our people.
Right. Exactly. All right. Let's move on to pharmacy. So, yeah, we could talk about this all day, right? Is an independent pharmacy benefit manager part of that cost containment equation for you? How does that work? What does it look like? Tell us all the dirt. No, I'm just kidding. You don't have to tell us the dirt.
No, I mean, it's not dirt as much as it is like, common knowledge and common industry knowledge is, okay, I'm going to work with one of the big carriers because there's a pretty logo on my card, and that means that they're the best. And I think that's something that employers really need to sit back and revisit, because for us, as an example, at my last company and this one, we were working with the big carriers and we switched out to an independent pharmacy benefit manager. It's the same medication, same everything, but we were paying 30% less.
Wow.
And as an HR professional, that means a lot, because I look at us, we're not a cost center. We're contributing to the bottom line of a company. And that is something that everyone should really explore, because it really opens up a lot of avenues for cost containment. So it's not just the pharmacy benefit manager. It's what do they offer inside that program that can be extremely beneficial to the members that are on the plan, but then also the savings to the bottom line. And it's really just about communication. That's the biggest hurdle.
Yeah.
It's companies being willing to go through the change management process and the proper communication, because if not properly communicated, it could be an epic fail, unfortunately.
Oh, yeah, absolutely. You don't want to have that person being put on step therapy in tears and not understanding what's going on and what their next option is. Yeah.
Yeah.
But it can be a huge win if communicated well and people understand.
Yeah. And the one thing I've said, because I do talk to a lot of insurance advisors all the time and HR folks, and, I do a lot of speaking and training around the country. And I'm always saying, if a company is interested in trying a cost containment strategy, switching out the pharmacy benefit manager is the least disruptive. And you're going to have savings, and it's going to be easy for the member, because they're just going to change the BIN number and the RX ID with the pharmacy they use, and that's it. It's like going from one carrier to another. There's nothing different.
Yeah. Are there any particular traits that you look for in a good pharmacy benefit manager?
Yes. So one of the things for us is, reporting and analytics and availability, because, even in your pharmacy data, that tells a big story about what's going on in your population. And then you can correspond it and correlate it back to your claims and then put plans together. So the data and analytics, the service is super important. Like, how do they serve the members? And also, what kind of programs are they using to help facilitate cost savings where the employee or member is not going to be impacted? Like international pharmacy, specialty pharmacy, things like that, where there are many opportunities to save money.
Most definitely. Really appreciate that. And then sort of stepping back from benefits, but not leaving benefits completely.
Yeah, I'm like, how did I get here? I used to hate healthcare and benefits like years ago. I'm like, I don't want to deal with that. I don't want to go and tell my employees they're paying more and getting less. That was like a nightmare.
Exactly. So if you think of benefits as part of the brand of the employer in competing for both new talent, but retaining our talent, do you think benefits really matter? Do they set you apart? And are there any ones that actually move the needle?
I absolutely 1000% believe that benefits set you apart from your competitors or any other organizations. And my theory on that is that we have 4 generations of people working in the same workplace now. Mm-hmm. That means that it really is not a one-size-fits-all benefit plan anymore. Mm-hmm. And companies really need to be more thoughtful about what kind of benefits they're offering. And it's really related to the population of their employees. So being more thoughtful about what's being offered and getting away from a traditional, model and not offering things that really can complement someone's journey at an employment. So, for example, people that are younger might want fertility coverage, or GLP-1s or whatever it is. I know there are people that will leave companies because another company is offering the weight loss medication.
Yep, I've heard those too.
Yeah. I mean, so it's, who is it you're aiming to really attract and retain and making a benefit plan around that culture? And that's the other thing is who are you as an employer? What is your culture? And making sure that if you say, we want to take care of our employees, it translates to what you offer in the benefits package.
So, Stephanie, you've been doing this for 30 years. Yeah. How do you know what your employees want? Are you doing surveys? Are you just in touch with them? How do you figure it out?
Honestly, it's a little bit of everything. I think it's very important as HR professionals that we're approachable. We're there to remember that we wouldn't be there without the employees.
Yeah.
So making sure there's always touch points with them. It's active listening when things are going on in their lives. It's also regular communication, and it's getting to know your population. So it's a little bit of everything. And again, it's not a one size fits all. Like our traditional thought of what our healthcare program should be is not the way it used to be anymore. Because now you have so many point solutions and add-ons to plans that can really enhance the experience. So it's definitely thinking outside the box.
Yeah, definitely. Well, you have shared so much already. If you could give just one last piece of advice that you want every HR leader to hear, and it doesn't even have to stay in benefits, what would it be?
Yeah. Wow. Okay. I know I feel like the old veteran HR person now, and really my goal is because I love the profession, and I think that HR is really undervalued in the sense where all we've heard our whole careers is HR is a cost center. And I completely disagree with that. HR handles the employees, which are the largest asset a company has, and the healthcare plan, which is the second or third largest line item. So those two things don't make sense to me. Mm-hmm. Where we're a cost center, but you're going to handle all these giant projects. So I want my fellow HR professionals to understand that, you have the ability to have a major impact on an organization. Yes, financially for the bottom line, but what you offer to your employees is so important. So just continuing to learn and educate yourselves on things that are really going to move the needle and have more impact.
Stephanie, I have a suspicion that people have heard things that they love today and want to know you. If that is the case, how should they find you?
Well, the best way to find me is on LinkedIn. I'm always posting content that's relevant to HR professionals and insurance advisors. So that is the best way.
Awesome. Well, Stephanie, thank you so much for your time. Thank you for your passion, and thank you for generously sharing it with our listeners.
I'm always happy to do it.
Big thanks to Stephanie Porrino for sharing clear, actionable strategies HR can use to control costs without compromising employee experience. This is the Generous Benefits Podcast, where we keep it practical, personal, and people first.